Just think about this for a second. It did take Arizona almost 5 months, took them 4 months and 26 days to get from their very first case to their first 50,000 cases. But their next 50,000 cases, to get from 50,000 to 100,000 cases, that took 15 days. Arizona now does have the highest positivity rate in the nation. Over 25% of their tests are positive. That means they have the highest proportion of tests in the country coming back positive, which means they are not able to do enough tests. According to the Arizona Republic, the state's positivity rate week by week since early May has gone from 5% to 6% to 9% to 12% to 14% to 18% to 21%, and it now stands at over 25%. Week by week by week by week, it has gotten worse and worse and worse. That is a sign of an epidemic out of control and testing that is not able to keep pace. And testing is the first thing you need to be able to do to even try to keep pace. And it has run rampant through every aspect of the healthcare infrastructure that Arizona has. Arizona hospitals set new records for the number of people hospitalized and the number of people turning up at the ER almost every day now. They hit 1,000 patients hospitalized in June. They're now over 2,000 patients every day, and a new record every day. Today, the Arizona Hospital and Healthcare Association requested waivers from the state so they can start doing things that they could never do before, things like transporting patients in private vehicles and putting adult and pediatric patients in the same hospital rooms if they need to because they don't have enough beds, they don't have enough room. But take a look at Arizona's second largest city. Look at Tucson. Tucson's in Pima County, Arizona. The Arizona Daily Star reporting that Pima County residents are going to their local hospitals with symptoms of COVID-19. But now there is not only the prospect that their local hospital won't have room for them, and so they'll be transferred somewhere else in Arizona. Now there is the prospect for Tucson COVID patients that they'll actually have to be transferred out of state just to find a bed, just to find somewhere they can be taken care of. Quote, Pima County residents with COVID-19 are being treated now in San Diego, California, and Albuquerque, New Mexico, and Las Vegas, Nevada, when shortages in staffing, equipment, or bed space make it impossible for hospitals close to home to take them. As of the start of this week, for the whole Tucson region, there were 11 total ICU beds available for the whole region. Tucson's like 500,000 people, right? I mean, for the whole region, 11 ICU beds? And that 11 beds includes beds at what is supposed to be the overflow facility of last resort. It includes beds they've tapped at the local VA hospital. That's how they get up to the grand number of 11 beds available for the whole region. The Pima County Health Director explaining to the Daily Star that the desperation of these measures is of necessity. She told them, quote, the emergency room situation went from stable last week to, without equivocation, critical this week, as the numbers of new coronavirus cases in the county has risen tenfold in the last 2 months. They've got the highest positivity rates in the country. They've got hospitals overtopped now and ongoing. They're having to transfer patients not just in-state, but out of state to find them beds. Their caseload has gone up tenfold in the last 2 months. In a state that cannot get testing. Imagine being the health director in charge of that county. Imagine being the health director in charge of this rapidly expanding conflagration. Joining us now is that health director, Dr. Teresa Cullen. She is the public health director for Pima County, Arizona, home of Tucson, second largest county in Arizona. Dr. Cullen, thank you for taking time. I know that you are in incredible demand right now.
Thank you for inviting us to be on.
So you know the situation much better than me or than anybody else. Let me just ask you first if I got anything wrong or if news has outpaced anything I explained, or if you think I'm looking at any of that the wrong way around in terms of understanding what's happening in Pima County.
Well, Pima County is over 1 million people, which makes the number of ICU beds even a little more stark. The access to them is more significantly limited because we have such a large population. We're a rural, semi-rural, and urban population. We're a very large county. We have 2 American Indian reservations. We have a border with Mexico. We're a very eclectic group in terms of the county, but everything else you said is accurate.
In terms of the resources in your county and what that means for an individual person who may or may not have tested positive, who feels like they need to go to the hospital because they have symptoms and they're worried. If somebody turns up at an emergency room right now in one of your hospitals in Pima County, what can they expect in terms of being cared for and where they will be cared for and the prospect that they might have to be transferred alone somewhere far from home?
Yeah. So I think what's important to note is that as a community, Tucson is a very cooperative community. Our hospitals are working well together. We have multiple meetings every week with the hospitals so we can assess what's going on for them, not only for ICU beds, but also for hospital beds and for access through the emergency room. If someone presents today to the emergency room, and I would remind everyone the emergency room, the ICU situation can change in a very quick period of time. So when we report numbers, we're reporting static numbers. Obviously, the situation is dynamic. But if people present to the hospital, obviously they can get appropriate care. I think the thing that is most concerning is that if patients need intensive care, will they be able to get it at the hospital that they self-present to, or will they be required to be transferred? Because Arizona is a rural community, it's not uncommon historically for patients to have been transferred from rural settings to the more urban settings. What we're seeing now, however, is accelerated rates of transfer as the hospitals work with the state through something the state put together called the Surge Line to try to find the appropriate bed for a patient that needs intensive care.
Given the positivity rates in Arizona, given what you are dealing with in Pima County and in Tucson, given the strain on the hospitals that you've been so forthright about, talking to a national audience right now, is there something that you need that you don't have? Is there something that this country should be providing you in terms of help? You are really at the tip of the spear right now in terms of where this American epidemic is. Do you need something you haven't gotten?
Right. Well, we work very closely with the state and with the hospitals. We actually activated 2 national disaster medical teams are in the city right now. We've activated ventilators coming to us from the national stockpile. We've activated a volunteer corps to come help us. Obviously, I think just like everyone else, including the earlier segment on that other hospital, people need trained staff. So it's one thing to have access to a bed. The other thing is to have access to the staff that can appropriately and adequately take care of you. I think the concern that we have is that we're seeing, once again, this logarithmic increase, what you talked about. We have a 10-fold increase, a logarithmic increase in 5 days. We're not sure where that's going to stop. We've done some interventions like masks that we think will perhaps mitigate some of that. But right now, we are still on the cusp of increasing our cases. So what do we need? Well, I think we need your prayers, which you mentioned earlier. But I also think what we need is just an awareness that the toolbox is pretty limited. And our toolbox requires our community to really come together. A lot of what we need to do is depending upon our community wearing masks, physically distanced, and at the same time, ensuring that we have the resources that our patients need.
Dr. Teresa Cullen, Public Health Director in very hard-hit Pima County, Arizona, where I know you and your colleagues are doing your best, and the eyes of the country are sort of upon you right now because of how hard you've got it. Good luck, and keep us apprised. If there is something that you want the country to know about how you are coping and what you're doing, please come back.
Thank you very much.